Good morning, everybody, and thanks so much for joining us this morning. We're really thrilled to have you all here. Many of you are familiar faces who have been attending sessions with us over the last number of months, and I want to thank representatives from the media for being with us as well. As chair of the All-Party Committee on Mental Health and Addictions, I know I speak for all members present today when I say that we are very pleased to be providing an update on the work the committee has completed so far. Since we first began public consultations back in May, this process really has taken on a life of its own, with a tremendous amount of participation already to date from residents right across Newfoundland and Labrador. We've sat with individuals, we've sat with families, we've sat with community groups, we've sat with experts, we've sat with advocates, all sharing invaluable perspectives and lived experiences that simply must be heard if we are to create real positive change in our province's mental health and addiction system. The passion and the courage and the honesty we've seen has truly been inspiring. We've had the privilege of hearing stories from people all around Newfoundland and Labrador. We've heard stories from people who felt they had nowhere to turn for help. We've heard stories of desperation and we've heard stories of loss. But we've also heard stories of hope. We've heard from community leaders who brought key insights for new ways to connect people with services and supports. We've heard from advocates, many of whom are in the room today, who work incredibly hard on behalf of those living with mental health and addictions issues. The truth is sometimes difficult to bear, but we cannot turn away from it. If we hope to do what is necessary to improve our system, we have to begin by listening carefully. And that's what we've been doing for the last number of months. The consultation process so far has resulted in the creation of an invaluable information resource. And that resource will guide our next steps in developing recommendations for improving the mental health and addiction system in the province. I know my colleagues are also very proud, as I am, to be members of this All-Party Committee on Mental Health and Addictions. And I want to acknowledge the presence of other members of our committee that are here today as well. As we've said before, the goal of enhancing our mental health and addiction system in the province transcends party lines and it transcends politics. We are in this together. And without that collective vision and a unified approach, we would simply not be fulfilling our respective duties on behalf of Newfoundlanders and Labradorians. So today, as chair of the committee, I know I speak for all members when I say we are pleased to provide an update with the release of a report on progress to date, as well as next steps for continuing our work. So now I'll draw your attention to the screen and we'll get into a brief presentation. I'll open and close, and Andrew and Gerry are going to present the meat of the presentation on some of our key findings and themes. So first of all, we know the numbers. 1 in 5 of us will experience a mental illness or addiction in any given year. The chance of developing a mental health issue at some time in our lives is close to 50%. In 2012-2013, there were 3,000 hospitalizations related to mental illness and addictions issues in Newfoundland and Labrador. And referrals to mental health and addiction services in the province are steadily increasing. We know the area of mental health and addictions needs our collective and undivided attention. It affects so many of us in this province, and we must ensure the right services are being delivered by the right people at the right time to those who need them. Next slide, please. It's that need that inspired the establishment of the All-Party Committee on Mental Health and Addictions. It's also what's defined our approach. Without hearing from those who have lived experiences and insights, we could never hope to achieve a more effective system. The All-Party Committee is the first of its kind in this province, and it was formed with a vision to improve our province's mental health and addiction system through a thorough review and public engagement process. Next slide. Outlining the process for engaging Newfoundlanders and Labradorians was the first step in our process. We knew there was a wealth of vital information out there, and that people had ideas and they had suggestions based on their own lived experiences. The challenge was in gathering it and establishing a way to apply it to the overall process. So as a committee, we decided on a multi-pronged approach to reviewing the province's mental health and addiction system. The review process to date has allowed us to identify the system's strengths and challenges, and discuss potential solutions that will have a very real impact on the daily lives of those living with mental health and addictions issues. The approach has included province-wide consultations, public consultations in various communities, during which we gathered vital information through public presentations and discussion sessions as well. We've also collected significant information by requesting feedback and suggestions online and also by telephone, and there have been written submissions as well. We've consulted with the regional health authorities. We've consulted with mental health professionals. We've consulted with community organizations throughout the province as well. The committee has visited Her Majesty's Penitentiary. We've visited the Youth Treatment Centre in Grand Falls, Windsor, and we've visited the Waterford Hospital. We remain committed to keeping this entire process open and information available to the public through a variety of avenues. Next slide. As I've already said, we've heard from the people of Newfoundland and Labrador, and we will continue to seek input from area experts, outside experts, from community groups, from residents, as we conduct remaining consultation activities. All raw data from consultation sessions has been made available on our website, which is beheardNL.ca. Transcripts were reviewed and coded, and major themes and sub-themes have been identified, and we're going to walk you through that this morning. But what we have heard so far is loud and clear. There is a need for greater access to service, better quality of care, increased mental health promotion and prevention efforts, enhanced policy and programming, and strengthened community supports in order to improve the provincial mental health and addiction system. Overall, the predominant theme that has come to light so far has been the discussion around access to service and supports. We know that this is a key barrier to recovery for many, and as such, it remains a key focus for the All-Party Committee. We must find ways to offer access to much-needed services to all residents, regardless of region, regardless of language, regardless of socioeconomic status, gender, ethnicity, or ability. And by continuing to work collaboratively, we firmly believe that we can achieve our goal of finding innovative solutions to improve mental health and addiction services for residents and for families throughout Newfoundland and Labrador. I'll now turn things over to my colleague, Ms. Gerry Rogers. She's an all-party committee member, the third-party critic for mental health and addictions, and the MHA for St. John's Centre. She's going to take you through a few of the first of the key themes that have been identified. Gerry.
Thank you very much, Steve. I'm very happy to be here, and thank you for everyone who has come today. About a year and a half ago, I had a meeting with a group of people in my district, and I said, what's keeping people awake at night? What are some of the most burning issues? And without exception, and there were younger people, older people, people from all kinds of backgrounds, and they said mental health. So we decided to have a town hall. We thought that maybe 65 people would show up. Over 350 people showed up. The hall was packed. The doors had to be closed because of fire regulations. It was standing room only. And we heard what people had to say. They talked about access. They talked about lack of services. They desperately talked about the need for help, for targeted help. They talked about the need to support community groups. And one other thing that they talked about was the need to get together, to talk about all the issues and to look at what we could do. So out of that came the Community Coalition for Mental Health, an incredible gathering of people with all kinds of expertise who said we can and we must do something. And then about a year ago, they launched that Community Coalition. Over 1,000 people gathered together at Holy Heart. And what we had were the people of Newfoundland and Labrador standing up for change, with determination, with hope, and with expertise. And it's they that called for an all-party committee to look at these issues. And today, I would like to dedicate this session to the people of Newfoundland and Labrador who have brought us to this point. Newfoundland and Labrador spends about 5 to 5.5% of healthcare dollars on mental health. The majority of Canada spends about 7 to 8% on mental health. And the Mental Health Commission of Canada recommends that 10% of healthcare budget dollars be spent on mental health and addictions. We still have a way to go. It has been an honor and a privilege to do this work. People have been courageous, and they took great risk, some of them great risk, to entrust us with their stories. Often they're stories of pain and suffering, some of incredible pain and suffering, and I want to thank those that took that risk. And folks took that risk with hope and with determination because they trusted that together we could make things better. They are standing up. Because the many individuals and families who have told us their stories have also told us how they think the system can be improved to better serve the people of Newfoundland and Labrador. We also heard from people with lived experience. We heard a lot from moms and dads, healthcare workers, mental health and addiction workers, nurses, doctors, social workers, community groups and advocates. We heard from teachers, from guidance counselors, from corrections officers. And I want to thank all those as well who took the great risk to talk about the huge gaps in services in their workplaces and who work so hard to deliver the best services they can in spite of those huge gaps. And some days on the road, listening to the stories, some of those days were really tough. And what stood out for me were the stories of people desperately, desperately seeking help, or desperately, desperately seeking help for their loved ones. Often people knowing what it was they needed, but not being able to get that help. And the waiting, and the waiting, and the waiting. As one person told us, mental illness and addictions don't do well on wait lists. But these are also stories of resilience and of determination and of hope. And the stories we heard were reaffirmed by staff and community groups who delivering services under some of the most difficult situations, knowing that if they had the right resources, they could help people. Knowing, too, that mental illness and addictions don't do well on wait lists. I also want to note, and I think it's really important to note, that people told us when they were able to access help, that they had praise for the nurses, the doctors, the mental health workers, the community workers that they saw. That when people finally accessed help, that in a lot of cases, the services were great. And I also want to point out that mental health and mental illness are not the same. Some people with mental illness can have good mental health if they get the help at an appropriate time. And that is our goal, to ensure that all Newfoundlanders and Labradorians have access to the services and supports they need so that they can live with good mental health. I would just like to share with you some of the wait lists that were identified specifically in Eastern Health. And we do know that services vary in different regions and in different disciplines. But the referrals for mental health in Eastern Health are about 800 to 900 a month. Kids present with the number one issue is anxiety. And that often results in behavior problems and self-harm. And then we heard about the long waiting lists for kids to get assessments, for kids to get access to psychiatrists, to kids to get access to ongoing therapeutic services. For adults, the number one presenting problem is anxiety and then depression and anxiety. As of March 31st, 2015, in Eastern Health, there were 1,825 adults on the wait list for help. Plus, there were 1,500 waiting for intake to be screened so they too could be put on the wait list. 12% of the people on wait lists were priority 1. 33% were priority 2, people who needed to be seen within 2 months. 50% were priority 3 with mild to moderate presenting problems who had to wait up to 20 to 24 months, who had to wait up to 2 years to see a psychiatrist or a psychologist. Can you imagine if you had cancer waiting up to 2 years to see your doctor? Again, the Mental Health Commission of Canada recommends 10% of our healthcare dollars go to mental health services. We also wonder what's happening. Why do we see more referrals? Because of the awareness campaigns that have been undertaken, the anti-stigma campaigns. They are effective, but there's also recruitment problems, especially in rural areas, recruitment problems, particularly with psychologists. We have an extreme shortage of psychologists across the province and in the schools. There's also a high no-show rate of 30% of people who are either too sick or for some reason, sometimes economic reasons, cannot get to their appointments. So it points out to the fact that our services, although effective when people get to them, are not flexible enough to meet the various needs of the people who need them. We have psychiatrists doing clerical work and IT work. We do not have a system, again, that is flexible and nimble enough to be able to truly meet the needs of the people who are seeking help, nor also to support the people who are doing the help. One of the major issues that was raised without exception, raised by psychiatrists, by nurses, by social workers, by community workers, by correctional officers, the list goes on, is the issue of affordable housing. A doctor said, quote, "Many of my patients survive or try to survive on $60 a month because of the high cost of rent. We put people on meds that cause diabetes and high cholesterol, and they can't afford decent, healthy food." A mental health nurse said to us, "I took a patient to her new home and I cried. And I said, 'Holy cow, I can't do this.' It was the most deplorable condition." Dr. Lotta, who's one of the most senior psychiatrists here in the province, quote, "The life expectancy of people living with mental illness is 14 to 25 years less than a person in the general population. People with mental illness die a lot earlier. This does not include suicide." And he said the people living with mental illness cannot often advocate for themselves, and that we need advocates. He said the 4 major issues that he deals with as someone providing help to people with mental illness. He said that the Waterford is a building that is older than Canada itself. It's not conducive to getting better. The only reason it works when it does work is because of the dedication of the staff who work in this building. The building is non-functional. It perpetuates stigma. The morale and the general well-being of those with mental illness and the staff are deplorable. The Waterford must be replaced. It is urgent. And his number 2 issue, housing. He said, "I have patients every single day who cannot be released from hospital because they live in hellholes. We don't discharge them. That's why they're not out on the streets in cardboard boxes. And it costs $1,500 a day to keep somebody in the Waterford. Housing," he said, "is completely urgent." We heard from another doctor who said, "Sometimes I think it's almost useless to try and even intervene and help someone if they don't have a decent place to live. Without a decent place to live, people cannot get better." And he said, "We also need more. We need an addiction center of excellence. An addiction center of excellence that's based on the recovery model and harm reduction." He also talked about, many of the doctors talked to us about the Newfoundland and Labrador prescription drug program and the problems that they have with that, and how at times it is so restrictive that it affects the diagnosis that doctors can do. And many doctors talked about the need in the policy for change in the policy and procedures of the Newfoundland and Labrador prescription drug program. One doctor even went so far as to say, if I ever leave Newfoundland and Labrador, it will be because of the Newfoundland and Labrador prescription drug program. I believe also that many of the people who spoke with us have very concrete ideas on how we can make the system better. And I will stop here now. But just before I stop, it was also the issue of the intersection of the health system and the justice system, the correctional system, and how the majority of people in our justice system who are incarcerated either are dealing with mental health and/or addictions issues. And again, corrections officers talk to us about when people are released, they have nowhere decent to live, and the incredible need for supportive housing. So I'll turn this over to my colleague, Andrew.
Thank you, Gerry. Thank you, Steve. And again, thank you to everybody that's taken the time to be here today. Again, this has been certainly a worthwhile experience for us all, I think, just the opportunity to go around the province and to listen to people, to talk to people, and to hear their stories. And I appreciate the opportunity that I had. I'm sure we all did the opportunity to do this, and the members that aren't here but also went around the province. Like anything, I think there's a few thank yous that had to go out when you do something like this. And again, one of the first ones is to the staff that have made this process work. We've had a lot of great people that have made these sessions work. They've helped put these together. It doesn't just happen on its own. So I want to thank the staff, everybody that's helped do this. Secondly, I want to thank the other members again. I think it's been a learning experience. We've all had some background in this. We hear about it. We talk to constituents. But going around, I tell you, as Gerry and Steve both mentioned, the stories that you hear sometimes are heartbreaking, and you learn so much more. So I think it's been so good for us that way as legislators and policymakers. And finally, again, as mentioned previously, some of the people here that took the time to come out and speak to us and to share their stories. And again, when you hear them, it's heart-wrenching in many cases, people taking that opportunity to speak and tell you of their story, which has been hard to describe in words sometimes, the things that the trials and tribulations people have gone through. So for people to share that with us, and hopefully for us to be able to put that on paper and make strategies and plans going forward to help them, again, I want to thank those people for doing that. As Steve mentioned, there's a lot of information that we've taken in, and what we've done now, I think, is put that through the help of the Centre for Health Information into a theme document. So what I'm going to do is just go through a couple of the themes that have been put there and sort of what we heard as we went around. We did go all around the province, and certainly we have other places that we've yet to go, and we will get to. So I'm just going to start off, and I'm not sure, I'll leave it to Steve to tell me which slide I'm supposed to be on. I think I have theme 3, was focusing on the promotion of positive mental health and the prevention of mental illness. Now, again, we're talking about themes here because at the end of the day, a lot of the things we heard across the province were the same, whether you're in downtown St. John's, or if you're out on the south coast, or if you're up in Labrador, it's the same stories that we're hearing. So we know that the issues exist all across the province, no matter who you are or where you are. Again, things like the social determinants of health, stuff like housing and employment, it's hard to focus on improving or bettering yourself and your mental health when you've got to worry about the necessities of life. And that was a big thing that we heard everywhere we went. Another one, and this one really hit home to me, was when we talked about supporting schools in the promotion of inclusivity and mental health. And as the father of a son who just started school this year in kindergarten, again, you're giving your child to the school system, to their teachers. So to hear from parents talk about, the fact is they're there every day. So what a better spot for us to start this work and to make sure that our teachers and educators have the tools that they need to help our children. And again, knowing that a lot of people's mental health issues or illness start off as youth, it's right there. So we were really happy to hear that, because we thought that, and to hear that, we know that it was something that we need to continue on with, to make sure that our educators have those tools and supports that they need when it comes to our most precious cargo, as they say, our children. moving on here, again, when we talk about the prevention of mental illness, well, as it relates to anything, again, one of the things we hear is that whether it's physical or mental health, they're all important. You know, one is just as important as the other. And when it comes to that, prevention is the key. Prevention is always better than the cure. So we talked about the things that we can do to ensure that prevention plays a bigger role as it relates to promoting positive mental health. We know that at the end of the day, it's going to better people's situations, and it's also going to make things easier as it relates to the cost of mental health, which we see here. It's rising and it continues to rise. So again, prevention was a huge factor here. I want to echo something that Gerry mentioned and Steve also mentioned. One of the big things that was also unanimous across the province was that, you know, we know there are limitations, we know there are issues, but most people that talked about their healthcare providers and their advocates had nothing but applause and positive things to say about the people that helped them in the system. It was unanimous across the board. It was uniform, saying, look, you know, sometimes it's difficult getting in the system, but once we're in there, the people that we've met have helped us. They've become more than just help, they're friends. And we saw that when you're sitting at these one-on-one sessions that we did, no matter where you were talking to people firsthand, you could hear that in their stories that they told us. So we were glad to hear that the people in the system are recognized for the work that they've done. Again, talking about the, I guess one of the themes here, a lot of it came back to education and awareness. You know, we need to do more, as you're talking about things like stigma. That comes down to increasing education, increasing awareness, a lot of it through the school system, but also making sure the messages get out. Things like promoting psychological resilience. We need to make sure that the tools are there to help people. So that was one of the big themes that we've heard. And I believe, Steve, this is going to be made public so everybody can see this this document that I appreciate Centre for Health Information putting out. As you can imagine, we heard a lot of information. So to be able to condense that into themes and hopefully which is going to lead to strategies and plans. Another thing that we talked about was policy and programming, what we're doing going forward. And the big thing I want to concentrate on there that we heard on a number of occasions was the need to apply a mental health lens to decisions that government makes. We know that government obviously is prevalent in our life, whether it's policy, whether it's plans, departments. We're all, again, we fall under government. And so when government makes these decisions, to have that lens thinking about what can we do to make sure that mental health is promoted and made aware as it relates to these decisions was something that came through very, very loud and clear. So that's clearly noted here in the document, whether, you know, when we talk about also a harm reduction lens, when we talk about all new policies and programs be considered within these frameworks. So there were steps there that we think can be taken and concretely applied to government decision-making going forward. The last theme that I have here is strengthening community supports. And again, I see a lot of advocates here and people in organizations that have been doing great work. And again, they was unanimous in applauding the work that they've done, the help that they've done. Many volunteers doing this just, you know, every day out there on the street doing what they had to do for the good of others, for the good of their neighbors. So they were applauded. And one of the things that came forward is that what can we do to ensure better partnerships, stronger partnerships working with these advocates. And again, there's so many, they're all over the province. So we recognize the good work. How do we strengthen that work with these government advocate partnerships? The other thing, obviously, was the delivery of service. Coming from rural Newfoundland and Labrador, we know that sometimes the service delivery is tougher. And so that was clearly mentioned as we went outside the capital city, was to hear that, look, the issues are all there. How do we make sure that the services get delivered there as well? Other things, again, I think I can say very clearly, one of the big things we heard when it came to community supports was the infrastructure. And we heard about the Waterford. I don't know if we never heard much about it. But it was loud and clear. Every session we had, it was loud and clear about, you know, that is the face of mental health as it relates to this province. So we heard about that very loud and clear as well. Again, I had mostly just a bunch of notes here, but I think overall what I wanted to say has been a very positive, beneficial experience, and I appreciate the opportunity to be a part of it and to work with my colleagues. And I think that this transcends, like Steve said, it transcends politics. The fact that we're all on the same page here working towards a common goal is what's necessary, and to know that people did come out and speak to us was appreciated, and this hope something that we're going to continue on with as we make progress with this goal.
Thank you, Andrew, and thank you, Gerry. They've done a good job of giving you a quick overview of some of the themes that have emerged in our work so far, and our work is far from done. So you heard about access, you heard about quality, policy and programming, community supports, and as Andrew referenced, the document that summarizes the themes is being released today as part of our interim report. It's available online. You can go through it and learn more about what we've heard and seen so far. And the raw transcripts of our public sessions that have occurred over the last number of months are all there as well. So I encourage you to visit beheardNL and check that out. I want to thank both my colleagues for taking us through that information. I also want to thank Kevin Pollard and Felix Collins are here, who have been active members of the committee with us today, throughout the process, and they're with us today, so thank you as well. And Andrew, thank you for acknowledging our staff as well. We've had a great secretariat for this process that has provided incredible support to us in this work, so I want to acknowledge their efforts as well. As members of the All-Party Committee on Mental Health and Addictions, we have embraced every opportunity to hear from community groups, individuals, and families with lived experience throughout the province. And while the feedback and input we've received to date has been informative and insightful, as I said, our work isn't done. It's far from done. It's vital that we carry out more public consultation and hear the perspectives of Aboriginal people, experts in the areas of addictions, seniors, caregivers, women's, children's, and veterans' mental health, and LGBTQ mental health as well. So our next steps will include those actions and will allow us to form a fulsome, representative body of information that will really inform change in the system. The All-Party Committee on Mental Health and Addictions offers sincere gratitude to each and every person who has participated in the review process to date. Whether you've contributed by sharing personal stories and experiences, or shared ideas and suggested ideas for system improvement, or noted programs and services that are working well or need to be improved, the input we have received will be invaluable as we work towards final recommendations that will ultimately present to the House of Assembly. Ultimately, this information will help us transform the provincial mental health and addiction system to better meet the needs of the individuals and families it's supposed to serve. Because our work is not done, we intend to reconvene early in the new year. We've made a commitment on behalf of our parties to reconvene the All-Party Committee by the end of January. Regardless of the outcome of the election, regardless of if any of us are sitting here, it's our intention to ensure that this work continues. And the fact that all three of our major political parties are committed to that, I think speaks volumes about the fact that we believe in this. We know we can change the system, we know we can make it better, and we know we can put politics aside to some degree and be able to really work together for a greater good, which we've been able to do in recent months, and I'm quite proud of that. I know we're all quite proud of that. Through determination and through hope and through courage and insights of those with lived experience, we will continue to work to achieve the goal of a better mental health and addiction system in this province.